Going to hear is House Bill 7884 by Representative Morgan. Welcome, Representative.
Thank you. A dozen, 15 years ago, we didn't hear about transgender care for young people. Although in Europe they had started that care, here in the United States they really hadn't developed it very much. And in Europe it really started with adults, and then children started showing up. And so we look to Europe kind of to see what has been the results of caring for children. And we find out that there are a lot of really negative impacts on children. And so this bill seeks to restrict transgender medical interventions for children, anyone under the age of 18, not for adults, but for children. Because children can't make informed consent. They just aren't emotionally, psychologically, mentally ready to understand all the consequences of the decision. And the decisions are really severe. They can lose fertility, sexual function. There are cancers, cardiovascular disease, bone implications, a lot of really serious things that affect their future life. An adult can make those decisions, but not a child. A child doesn't know when they're 13 whether they want to be a mother or a father, but as they get older, they do. Recently, there was a study in the Netherlands, and this was a longitudinal study on 2,772 children. They followed them from the age of 11 till 26. And they found that if these children were allowed to, the children who were uncomfortable with their gender were allowed to grow out of it, which is what we always did in the past. That 96% of them grew out of it. And that's a good thing for those 96, because we find all these really negative impacts if we start them early. And also we find out that there is increased mortality risk to medicalizing them for their entire life. I can't imagine how uncomfortable it must be, how horrible it must be to be so uncomfortable in your skin that you are willing to medicalize yourself for your entire life. But we shouldn't be wishing this on children. If the results are that we let them grow up, by the time they're 26, 96% of them are comfortable with their sex again. 96%. That is a good thing. And we are rushing to medicalize them. And so many of the medical treatments that we do on children now are no more than experimentation. And that's why we find in many of the countries in Europe who were forerunners to ours, that they are not allowing children anymore. They're banning puberty blockers for children unless they're in research studies. It is not just routinely given, because the consequences for those children are so severe to their lives. Imagine going through your life with body parts cut off or changed. If you're a young girl, you can have your uterus removed, your breasts removed, and then you realize when you're in your 30s, you'd really, really wish you could be a mother. And there's no going back. And you made the decision when you were a teenager. Puberty is a tough time for a lot of kids. I mean, I remember it. You'd get a pimple on your face, and that was the worst thing that could ever happen to you, right? Or your boyfriend, and you broke up. It's a time when your hormones, you're just getting hormones, and you're not looking at boys anymore as people you play with, but as, they're kind of cute. So it's a really confusing time for kids. You throw in a breakdown in the family unit from divorce, or a father maybe losing his job. You throw in all of the different things that can happen to kids. A friend can die. They can be learning disabled. You shouldn't be taking that period of time when kids are so confused about who they are and where they belong in this world and throwing them into medical experimentation, because that's what's happening now. For kids who have, or young people who have transitioned, we find that for boys who do the vaginoplasty, they are 2 times more likely to commit suicide. They basically have been experimenting on these boys. Well, we'll try it. Let's see if this works. And it doesn't work. It's like an open wound in their body. And they have to have multiple surgeries to correct it. This is not about adults. Like I said, 4% still are uncomfortable with their biological sex after they're 26. So this is not about adults. I'm hoping that they do, therapy, psychological talk therapy, before they make the choices. But if they've taken all those other steps ahead of time, sure. They're adults. They understand the consequences. But not a 13-year-old, not a 16-year-old. I mean, when I was 16, I was more interested in whether I was getting my driver's license, quite frankly, or the dances that I was going to go to. And I don't know why our society is pushing kids so aggressively towards this kind of change in their lives. There was a time when kids were questioning, and parents and teachers and society let them grow up. Let them grow out of their confusion. And I think that's where we should be going now, at least until they're 18. This study says it takes many of them till they're 26. I wish we could say it till 26, but I'm at least hoping that we can say till 18, because we shouldn't be allowing it. It hurts children. That's it.
Thank you, Representative Morgan. Could you send us the link to that study?
Yeah, I have it here, so I can give
but
it to the clerk.
Yeah, if you could email us the link so that we could have it.
It's just recent. It just came out.
Okay.
No clinical studies have been done, by the way, where they, the blind studies, none of those have been done. The results, the implications for a person's health from the different hormones and puberty blockers and different drugs and chemicals that we're putting into people, there have really been no chemicals, no studies to say how they're affecting people's lives, people's bodies. But this is one that's just recent, and it's a significant one.
Thank you for that. Are there any questions for Representative Morgan? Thank you so much.
Okay, thank you.
The first 2 witnesses on this bill are Diane Santaniello and Jason Ramblad. And while they're coming up, I'll remind all the witnesses, please keep your testimony limited to 2 minutes. And if you've submitted written testimony, please don't repeat that to us. And please don't be repetitive in saying the same thing that's already been testified to verbally before the committee. Thank you.
Welcome. Make sure the red button is on, and you can go. You're ready. You can go first.
Hello, my name is Jason Romblad. I'm an unaffiliated voter from Woonsocket. I am here tonight to voice my support for Bill H7884. Thank you to Patricia Morgan for sponsoring this bill. If you take the time to read this bill in its entirety, it describes perfectly all the reasons it should be passed immediately. This bill is not an attack on anyone's sexual preference. The people who are pushing this agenda on our children will use the wording gender-affirming care, but we need to call it what it is: child mutilation. Allowing doctors to prescribe these untested medications which change a person's biological makeup and or allow them to remove body parts from our children is inhumane and should not be allowed in Rhode Island or anywhere in this country. Our children's brains cannot comprehend the lifelong effects these drugs and operations have on their body. On a personal note, I have 3 grandchildren, and a few years ago, when my granddaughter was 10, she made the statement to my mom, her great-grandma, "I hope my brothers do not ever want to become girls. I enjoy having brothers." I think it is vile and disgusting that people pushing this agenda are allowed to confuse our children in this manner and tell them that they were born in the wrong body. There's also some states in this country that are allowing officials to remove children from homes when parents do not agree with these beliefs. Let's make sure Rhode Island don't become one of those states. I implore both this committee and the Rhode Island legislature in full to protect our children and pass this bill. Thank you.
Thank you for your testimony. Are there any questions for this witness? Thank you so much. You may begin.
Hi. So my name is Diane Santinello, and I live in the town of North Providence. I'm here in support of this bill. I don't have the number, so it's the Children Deserve Help and Not Harm Act. Okay. So I spend 1 day a week babysitting for the children of a friend of mine, and the one word that is said most often in the course of the 5 to 6 hours that I'm there is no. I say no all day long. No, you can't eat candy for lunch. No, you can't play with knives. No, you can't stand on the very back of this chair. No, that's hot. No, that's sharp. No, that's too high, dangerous, slippery. You fill in whatever adjective fits. The days are filled with no, followed by, as much explanation as they can understand. Don't is also spoken a lot as well. And why is that? Because children don't know anything. They're learning, and that is their job at this stage in their lives. Not to make decisions, especially critical ones, but to learn. They're in the early stages of learning, thinking, and reasoning. And we, the adults, are called to be just that, adults. It is the children's, the minors' job to learn, and it is our job to teach and guide. We must not be led by the children. We must lead and most of all, protect. So my belief is that children are not able they can't make the simplest decisions, and whatever decisions they make are very often wrong. And that's why we say no and don't and show. So I would ask everyone to please support this bill and protect the children of Rhode Island. Thank you.
Thank you for your testimony. Are there any questions for this witness? Thank you both.
The next 2 witnesses are Amy Rodriguez and Jasmine Roy.
Welcome.
Thank you.
Make sure the red button's on.
Thank you.
There you go.
Would you like me to go first? Thank you. So I'm Amy Rodriguez, Chapter Chair of Washington County, Rhode Island, of Moms for Liberty. I'm in support of this bill, H7884. Children are created and born perfect When raised in a loving and stable home, taught to love themselves, they will thrive. This is not to say they won't have insecurities as they go through puberty, but they almost always grow out of them when left to mature naturally and let nature run its course. We have a social contagion called gender dysphoria that targets children as young as preschool. Once this psychological condition was named, it was given a means by which it spread. In the early 2010s, there was a 5,000% increase in young girls that identified with this disorder, which is when the gender identification messaging started to spread. Along with this psychological condition came a ready-made solution. I don't believe this was coincidental. Gender reassignment surgery is almost always promoted and prescribed to supposedly bring the body and mind in line to ease the dysphoria. The body is medicalized, but this does not cure the issue or several other issues like anorexia, bulimia, sexual abuse, past trauma that still exist. This typically makes matters worse. Puberty blockers are not reversible and come with deadly side effects. Children are far too young to make these life-altering decisions, and I don't believe parents are given all of the information as far as the actual risks of such medications, nor are they told factual data in regards to suicide being higher after medically transitioning as opposed to before. Empathy is being weaponized against loving parents and well-meaning but uninformed people. The suicide narrative is based on a lie and is the only justification, though false, to medically castrate and surgically mutilate children. Can I go on or am I done?
In conclusion.
In conclusion, children and their families, parents, and others need to be informed, not manipulated. Thank you.
Thank you for your testimony. And did you submit that in writing to the clerk?
I did not, but I can.
Yes, please do. Okay, any questions for this witness? Thank you so much.
Thank you.
Okay, you can go on.
Hello and good afternoon, good evening. My name is Jasmine Roy. I am a member of Moms for Liberty, and I have a 9-year-old boy. And I believe our children are our future. I believe that when we mess with the chemical compounds that naturally are in our bodies, and these options are irreversible, it does great harm psychologically. I believe that there needs to be more heroes that we look up to, that give our children pride in who they are and who they were born as. I believe that what is happening in our society today is irreprehensible. It's something that I have never witnessed in reading history. I don't believe that medical treatments and surgeries are the way to go for children under 18. If you cannot serve in the military and you cannot vote, and I have to tell you how much medicine you need to take when you're sick, you should not be able to have surgeries and puberty blockers that can make you infertile and further disrupt the production of the human race. Thank you.
Thank you for your testimony. Are there any questions for this witness? Thank you so much, ladies.
The next witness I'll call up is Mira, I'm sorry if I mispronounced this, Matanosian.
Welcome.
Thank you.
The red light is on, correct?
Should be now. Is it better?
Okay.
All right. Thank you. I'm not here on behalf of any group. I'm just speaking out because I think this is, I think, the first bill that's come through the assembly lately that could actually mitigate potential unintended consequences. I don't think it's a secret that I don't share politics with most people on this committee or in Rhode Island overall, but I don't think anyone is trying to make things worse for anyone. Kids, I just want to make that from the jump. I think there are unintended consequences to this bill, and just a brief example. Recently, it's similar to the safe injection site, which is not a thing, but it's essentially turning this, normalizing it, making it like underage drinking. You're going to actually see more overdoses. You're going to see, that's just my take on that. So I give you that for context, because with this, it's the same thing. It gives kids rather than let them go into this when they're young, let them go to 18. Do what you want to do from there. No one cares what you do at home if you're 18. If you want to sleep with whoever you want, do whatever you want, chop off whatever you want. I mean, I hope you don't, but you can do whatever you want. Kids don't need that option. I don't have kids. I don't want kids. I'm a broken record. I say that all the time, but this stuff is creepy, and I just think it needs to be called out. And frankly, if you want to go, it's why I opposed Rep. Stewart's bill on wanting to have basically porn available to kids in school. When you're 18, pretty sure the Amazing on Allen's Ave is still open 24/7. Go do what you want, get what you want. So the short of it is, kids don't need this option. Just leave them out of it. I mean, there's no need for this. So that's all I have. Thank you.
You're welcome. Thank you. Any questions? All right, thank you for your testimony.
All right, the next two witnesses are Reverend Dr. Donnie Anderson and Dr. Beth Cronin.
Welcome.
Thank you, Chair, and thank you, Committee. I'm the Reverend Dr. Donnie Anderson. I live in Providence, and I am a proud member of the transgender community here in Providence. I've been a minister for a long time. A number of years ago, when I was serving a congregation in Connecticut, we had a church that believed that medical service and medical help was from doctors was unnecessary, that God healed everything. And so in that church and in our town, we had families who were refusing to take their children to the doctor for anything. And the state of Connecticut came in and said, you cannot withhold appropriate medical treatment to children. And they called it child abuse. This bill calls for the state of Rhode Island to pass a bill that will withhold the insurance support and services that children need. Let me share with you. I'm 76 years old. This bill doesn't affect me. But when I was 9, less than 9, I knew nobody recruited. Back in the 1950s, we didn't have the word transgender. Nobody recruited me. I grew up in a stable family. We were great. I lived in Western Cranston. We had a great life. Nobody was recruiting me. I wasn't abused. I wasn't suffering from anything. I was just who I am. And that is, I am a transgender woman. And let me tell you what that ignorance did for me that's being extolled, that ignorance was so wonderful. It led to me for 69 years of shame and depression and difficulty, because it took a long time to figure out who I was, and then a long time to decide that I would come out and share with the world who I am. I am so thankful for doctors like this and for other people who are helping children understand who they are and let them follow their own path to who they are. Let me just close with this, my friends. I cannot tell you how difficult it is to listen to, and I was going to say misinformation, but it's not misinformation. This is lies. The lies that are being told in this country that are hurting untold numbers of children. I urge you in the strongest possible way to stand back against this evil and allow our children to be healthy and happy.
Thank you. Are there any questions for this witness? Thank you very much, Donnie. Doctor?
Good evening, everyone. Chairman Donovan, members of the committee, thank you so much for letting me be here to speak tonight. My name is Dr. Beth Cronin, and I am here today representing the American College of Obstetricians and Gynecologists in strong opposition to House Bill 7884. ACOG is a leading authority in reproductive health care and is committed to public policy based on facts and evidence-based medicine. ACOG believes that all people should have access to full spectrum of comprehensive evidence-based healthcare and opposes laws and regulation that discriminate against or otherwise marginalize patients. This proposed legislation is the exact opposite of a evidence-based legislation. It will stand to eliminate access to essential healthcare for transgender youth across our state. This bill will punish medical providers who follow standards of care for transgender patients, standards endorsed by the American Academy of Pediatrics, the AMA, and other leading medical authorities. I provide full spectrum OBGYN healthcare right here in Providence, including caring for many, many transgender and non-binary patients in my outpatient practice. I co-authored the ACOG committee opinion on healthcare for transgender and gender diverse individuals, and I present nationally on the impacts that gender affirming care bans have on my patients. State policy to deny this care will have grave consequences to the health and lives of our young people. I have cared for many young adults who are fortunate to live here in Rhode Island, having access to thoughtful, inclusive healthcare as youth, and who are able to discuss their needs for gender-affirming hormonal therapy and access those treatments with their physicians. I have had multiple patients describe the ability to start hormonal replacement therapy as an adolescent as life-saving. Eliminating this access to care will be devastating. Healthcare professionals who provide care for transgender children and adolescents follow well-established standards of care that have been developed through decades of clinical study and shown to be safe and effective. Healthcare provided to transgender children and adolescents involves in-depth screening with multidisciplinary teams, including medical and mental health professionals who are trained in these established standards of care. Patients are administered long-standing, long-known, safe medications that are as determined by this healthcare team. Taking away our ability to provide this care goes against medical evidence and limits our ability to provide holistic care as physicians. Transgender individuals face pervasive mistreatment and violence and experience high rates of suicide, poverty, unemployment, and homelessness. These discriminatory policies in the healthcare system will further widen the care gap and exacerbate structural inequities. I want to live, work, and raise my children in a state that is safe and cares about all children and doesn't place these barriers in accessing care. I implore you to consider these facts in voting against this bill.
Thank you for your testimony. Representative Potter has a question.
Thank you, Chairwoman. And Donnie, thank you for being out here again. I'm sorry that you have to continue to show up and speak on these bills.
We're not going away.
Thank you for being here. Question for you, Dr. Cronin, if you don't mind.
Not at all.
And it is doctor, so I think I heard in that you're an actual medical doctor.
Mm-hmm.
So
Yes.
you have a medical degree and a medical-based opinion on this subject matter, right?
That I do.
And you said that you follow evidence to reach your conclusions, right?
Correct.
Right. You mentioned grave consequences of a bill like this and the fact that this kind of treatment is life-saving. Mm-hmm. Can you speak a little bit more on that?
Absolutely. If you look at, there's many studies done, but the recent National Transgender Discrimination Survey looked at the rates, asked about all sorts of health consequences, but the rate of suicide attempts in this patient population, the respondents noted a 40% rate of lifetime suicide attempt. And so that in and of itself, this is life-saving treatment. These are patients who, not being able to access this care, listening to colleagues around the country who are caring for patients in states with bans, it has been incredibly devastating to not be able to provide necessary care.
And that necessary care that you're talking about, you said that any potential patient that would go through this, there's an in-depth screening of multiple healthcare practitioners,
Yes.
Right?
Yep.
Can you speak a little bit more on that?
Absolutely. So these are, especially in caring for youth, adolescents, these are care teams. So there's a social worker involved, therapist, along with the medical provider. Parents are involved in these conversations and discussions. This is not a 15-minute office visit where medications are prescribed for strep throat. This is a long, involved process with consent and assent of the patient and family, and making sure that all questions are addressed. It is a very, kind of talking about all of the pros and cons and options for treatment. This is not a decision that's taken quickly or lightly, but we are very lucky that we have many, many providers in this state that are well-versed and able to provide this care for our youth.
And would you say that patients who undergo this type of treatment, the amount of them is still pretty rare.
Yes.
Thank you.
Are there any other questions for this witness? Yes? Okay. Representative Kislak.
Thank you. So I think that that Representative Potter asked many of my questions, and I loved that. I wanted to thank both of you for being here, and I also, having you both up here testifying at the same time made me think during Representative Potter's great questions about what it would look like if 9-year-old Donnie was able to talk to his family and come in and see a pediatrician in your practice, and what that conversation would look like, and what sorts of options and paths might have been there. And I know we're not there and we can't ever live our lives any differently than we have, but there are 9-year-olds having these conversations with their parents and are able to have a different path. And I think, I wonder if either of you has any comment about that. And I also think it's clear from my comments that I am fully opposed to this bill, and it's a part of a dangerous national movement to target the trans community very specifically, and we can't be a part of that here in Rhode Island. But I wonder what your thoughts are about 9-year-old Donnie showing up at your clinic.
Yeah, let me just say this. I thought for years and years and years, decades, I was the only person in the world who was experiencing this. There was nothing out there. Nobody was talking about it. I heard somebody talk about, since this came out, there's like 5,000% increase. Sure there are, because we've always been here. It's just there's never been a forum. There hasn't been any vocabulary. There's been nobody to talk to. We had to hold it in ourselves and deal with it ourselves and think that we were somehow weird or strange, or that there was something wrong with us. Or, I was told, that people like me, God hated people like me. I mean, I had to live with that. I try not to think about it because, you can't go back. But I do wonder once in a while. Suppose my loving mom and dad and the doctor that we went to, because I did try and have a conversation, but my poor mother was befuddled. I just wonder when I did try to have that conversation, if we had gone to a practice like this, and the people the medical people and the mental health people I know here in Rhode Island and what they're doing, and they're not mutilating children. They're helping children live happy. Talk to some parents who say, I had a depressed, unhappy child, and now I have a happy child. I mean, sorry, I'm a preacher, I gotta shut up.
Thank you. No, I think I could speak briefly to that. I think, as you know, I'm an OBGYN, so the majority of my patients are, older teens and adults. But having done a lot of work in this space and speaking with colleagues and caring for young adults who have started hormonal treatment as 9, 10, 11 years old, at 9, a lot of this is a conversation and kind of talking about where the patient's at, where the family's at, what the goals are. And the medication spoken about is Lupron. That is a puberty blocking medication that is 100% reversible. This is a medication we use all the time in OBGYN to block, in our case, typically is using to shut down and pause puberty for young girls, or we use it in adults and other different medication situations. But this gives time to stop and pause and put a pause on puberty so that these young children are not needing to go through puberty twice. And it is truly, it has changed how we're able to provide this care.
Thank you.
Yeah, absolutely.
Thank you. Any other questions? Well, we have lots of questions. Okay, Representative Cotter, we'll start with you, and then Representative Stewart.
Thank you. I just respectfully ask, please be quiet when people are testifying in the back there, because it's incredibly disrespectful to the same folks that have been waiting to have their airtime. Please, you had your time to talk. Thank you. Everybody gets 2 minutes. That's so. Thank you for. Just please be respectful of others. Donnie, thank you for sharing your story. I know it's incredibly difficult to share, especially when folks are heckling you. So I appreciate you sharing your story. I know it's not easy. So thank you for being here today.
Thank you.
Representative Stewart.
Thank you both for your testimony this afternoon. Doctor, I have a question. In your capacity, are you familiar with what are some of the practices and standards in other countries as far as this form of care for young people?
In terms of, you mean specific practices elsewhere, I couldn't speak to that. I mean, the World Professional Association of Transgender Health are international guidelines for how to provide this care, and that's what we provide here in this state. But I can't speak to unique specific countries.
Right, but our current guidelines are consistent with those international guidelines.
Absolutely. Yep.
Thank you very much.
Absolutely.
Representative Fogarty and then Representative Fenton-Fung.
Just to refer back to your testimony, you referenced that you've written some material regarding this. Is it possible that we might be able to get a copy or a link to that you maybe be able to give to our clerk? Yeah. So we can look. And when was this done? Was it local information that you?
No, this was the American College of OBGYN National Committee opinion.
Okay, but still it would be good to refer.
Absolutely. I'm happy to provide that.
Appreciate that.
Representative.
Thank you, Chairwoman. Dr. Cronin, I'm just reading through some of the stuff here, and just some of your testimony, trying to get a better handle on it. What age would you say, and feel free to be very roundabout about it, would be the youngest patient that you've treated?
So the youngest patient I've treated has been, personally, is probably late teens, but that's just the scope of my practice.
Okay, yeah, I was trying to figure out as far as the age of consent and everything else went like that. Okay, all right. And so everybody under 16 still has to be consented by a parent?
Correct. These are patients that are requiring, that parents are there for consent and, counseling and conversation.
Okay. Do they get treated at women and infants, or if they're younger, do they go to a pediatric hospital?
In terms of, it depends. I mean, we have a pediatric adolescent gynecologist in our hospital who would see some of these patients. Most of this care, though, is performed in the outpatient offices, mostly in our family practice and pediatric offices throughout the state.
Okay, thanks for clarifying that.
Any other questions for these witnesses? Thank you so much for being here.
All right, the next two witnesses are Ryan Fontaine and Jay Watts. Welcome.
Thank you. Thank you, Chair Donovan and members of the committee. My name is Ryan Fontaine. I'm proud to testify on behalf of Thunder Mist Health Center in strong opposition to H7884. Thunder Mist is a federally qualified community health center with locations in Woonsocket, West Warwick, and South County. Thunder Mist serves over 62,000 people. That's 1 in 18 Rhode Islanders, with patients who come from every zip code in our state. Thunder Mist became the first in Rhode Island to establish a dedicated program for trans health that presently serves over 2,000 people. We are here for Thunder Mist today to fulfill our mission to improve the health of our patients and communities by delivering exceptional health care, removing barriers to that care, and advancing healthy lifestyles. The bill presented to you and the testimony that you've heard in support is based on incorrect information and a complete lack of understanding about the needs and experiences of transgender, non-binary, and gender-diverse people.
Ryan, can you hold on just a second, please?
Absolutely.
Can I just remind the audience, please, that if we're going to have conversations, please take them outside. Ryan, if you want to backtrack a little bit and start over, you can.
Sure. I'll pick up on the paragraph that I was just reading. So the bill presented to you and the testimony in support is based on incorrect information and a complete lack of understanding about the needs of transgender, non-binary, and gender diverse people. Healthcare bans like this one are dangerous political attacks that would prevent parents from getting their child the healthcare they need, healthcare that's supported by the American Academy of Pediatrics, the American Medical Association, and other leading medical authorities in the US, representing 1.3 million doctors. Sorry, Sorry, is it all right if I start from the top? I'm not sure
Yes,
if folks
I'm
have
sorry.
lost the thread at this point.
Take a breath and start wherever you'd like to.
Thank
Sorry
you.
for that.
So, as I said, I'm Ryan Fontaine, representing Thundermist in opposition to H7884. And to summarize briefly, Thundermist is a community health center. We serve over 62,000 people, which statistically is 1 in 18 Rhode Islanders. And we are also home to the first program for transgender health that was started in 2015. And today we serve over 2,000 patients in our trans health program. And we're here today to fulfill our mission as Thundermist, which is to improve the health of our patients and communities by delivering exceptional health care, removing barriers to that care, and advancing healthy lifestyles. The bill presented to you and the testimony that you've heard in support is based on incorrect information and a complete lack of understanding about the needs and experiences of transgender, non-binary, and gender diverse people. Healthcare bans like this one are dangerous political attacks that would prevent parents from getting their child the health care that they need. Healthcare is supported by the American Academy of Pediatrics, the American Medical Association, and other leading medical authorities in the US that represent 1.3 million doctors. As healthcare professionals, we see firsthand what is supported by the evidence. Transgender youth are able to thrive when they can receive the healthcare they need. Not only do we understand that based on the experience of our patients, but many of us also understand that based on our own experience.
In conclusion?
So again, not only based on the experience that we have as from our patients, but also based on personal experience as an out trans person as well, who remembers what it was like 10 years ago and how far we've come. We urge you to continue to support progress and reject H7884.
Thank you for your testimony. Other questions for this witness? Thank you so much. Okay. Yes, sir.
Good evening, Chair Donovan, members of the committee. My name is Jay Watts. I'm a licensed independent clinical social worker and the director of trans health at Thundermist Health Center. And I'm here tonight to speak in opposition to 7884. Earlier today, each of you received a copy of an open letter, which was signed by a coalition of over 470 organizations and individuals expressing collective concern over the package of anti-LGBTQ bills that have been introduced throughout the legislature this session, including the bill we're here for tonight. And that was submitted also as part of testimony for this evening. This letter adjusts these bills collectively because there's only so many adjectives one can use to say that a piece of legislation is harmful, dangerous, that it goes against the values of most Rhode Islanders, and that it originates from a model legislation from extremist groups seeking to impose their views on everybody else. But I have a few more specific words that I would like to speak about this bill in particular. Because bills that attempt a healthcare ban, like this one, are one of the most extreme political attacks on transgender people I have seen in my lifetime. I've been out for 20 years. This bill would not only ban evidence-based, medically necessary care for trans youth, it would do so by overruling a parent's right to seek essential healthcare services for their child that is backed by every major, reputable medical authority in the country, including the American Academy of Pediatrics and the American Medical Association. But it does not stop there, because the plan was never for it to stop there. As we're seeing in other states, the authors of this bill are allowed to slip through. It's not just about kids. It's about going after the very existence of trans people in society. Under the guise of protecting the children, the guise of protecting the children has already been quickly dropped across the country as bans have been enacted and critics have become emboldened to push forward the next piece of the agenda, which is to expand those bans to include adults, and by banning insurance coverage and to make access to care nearly impossible. There are elements of that agenda in this legislation. There's language that states specifically that we're talking about health insurance and exclusion not for minors, but for all people. In conclusion, Rhode Island has a reputation about being a safe and inclusive state that protects and affirms the dignity and the rights of all, including LGBTQI Rhode Islanders. It's widely known. This makes us both a beacon for those seeking safety and a target for those seeking to take that safety away, and I urge you all to be the beacon. Thank you.
Thank you for your testimony. Questions? You have one question? Representative Potter has a question.
Thank you, Madam Chair. Thank you for your testimony, both of you. I'm curious, one thing that you said there, and I know it's hard to kind of fit all of this into a 2-minute window, so maybe you can expand a little bit on that. When you said the authors of this bill let it slip, and I think you referred to something happening out of state, can you elaborate a little bit on that?
Yeah, so there's elements of that agenda that are in this legislation. There's specifically on page 7 of the bill, line 22, the language says a health benefit plan under an insurance policy or other plan providing healthcare coverage in this state is not required to provide coverage for gender transition procedures. The line above it references minors. The line below it references minors. That line does not. That is not an accident. And that's what we're talking about. And even in the testimony that you heard earlier, you heard testimony that slipped in of like, perhaps we should be pushing this off to age 26 because they're not looking to stop medical care for trans kids. So they want people to just not be trans.
And the letter that I think you both referred to that had a number, I think you said it was like 400 organizations and people that signed on to it. That's the one that I'm looking at that's signed by the National Education Association, the Rhode Island Commission for Human Rights, Rhode Island Public Health Institute, Open Door Health, Thrive Behavioral Health, Rhode Island Medical Society, and a number of academies of family physicians, pediatricians, psychiatrists, psychologists, OBGYNs, and a number of health equity zones, right?
Yes, correct.
Thank you.
Thank you.
Any other questions for this one? Yes, Representative McGaugh and then Representative Speakman.
Thank you both for being here tonight. Either one of you can answer this, or maybe if you both have anything to add. I know you referenced some of the national policies around this, and I included for the committee members the American Academy of Pediatrics recommendations from their policy statement, but I included a small portion of it, and so I just want to give you the opportunity, and you can do it now or if you want to submit it later, if there are parts of the policy statement from either the American Academy of Pediatrics or from the American Medical Association or from any other of the medical organizations that should have been included. I offer that up if you would please share it to me so that I can share that with my colleagues. So like I said, I just included the recommendations, but I just want to provide that opportunity for you to share that. Thank you.
Representative Speakman.
Thank you, Chairwoman. Yes, I want to thank you for your close reading of the bill. I see exactly what you mean. I am looking at the language, which says a health benefit plan under an insurance policy or other plan providing health care coverage in this state is not required to provide coverage for gender transition procedure with no reference to age. You're absolutely right. So thank you for pointing that out.
Any other questions? Yes, Representative Cotter.
Look at this.
Thank you for coming. I apologize that you had to start over. I think, democracy is incredibly important, and I know, everyone here has waited for their 2 minutes, and as representatives, we appreciate you coming and waiting your 2 minutes. We respect you. Thank you.
Any other questions? Yes, Representative Fettenbaum.
My apologies. And again, you point out page 7, line 22. And this is just, and I plead ignorance, okay? And I appreciate you educating me, a couple of us here. Are gender transition procedures required to be paid for by commercial insurance currently?
there have been statements from both these have been old. So going back to 2016, 2015, we've had statements from OHIC and from Medicaid saying that this is medically necessary care and that it belongs being covered and that it's discriminatory to have exclusions that ban that coverage.
Okay, all right, I had no idea. All right, thank you.
And if people want to see those old guidelines, I certainly have them. They're framed, put on my fridge, because if we think back to, I've been out for 20 years, we've had that policies in place for 8 years. I know what it was like before we had health insurance coverage. I know what it was like watching myself be able to take out a loan and access care that my friends were not able to access. And we're not going to go back to a time like that. And I don't want kids to be so scared that they're not going to have to leave the state to be able to access the medical care that they need. When we have families who have moved to this state to be able to get care because they're leaving places that already have these bans in place.
Thank you for your testimony. Anybody else? Thank you so much, both of you.
Thank you.
Okay, the next two witnesses up are Wendy Becker and Gregory Wack-Molsky. And while they're coming up, Rep McGaw, would you like your attendance recorded and votes recorded?
Welcome, Wendy. You can start.
Thank you, Chair Donovan and members of the committee. Thank you all for your time this evening, and thank you very much for trying to maintain decorum. It has been difficult given trans people have been the ones interrupted. I'm a social work professor at Rhode Island College, where I teach many clinical classes and have for 25 years, including ones on sexual orientation and gender ID. I'm also the lesbian parent of a trans young adult. I'm here to testify against House Bill 7884, the ridiculously named Rhode Island Children Deserve Help Not Harm Act. There is no piece of legislation I can think of whose name better describes the upside-down world in which we are currently living. Members of the trans community, thank you so much for your powerful testimony. I'm sorry you have to do this, and as long as you have to, I will too. Today, Representative Morgan is sponsoring a bill to deny the rights of parents to join with their children and their children's medical providers to make decisions about their own health care. She wants to pass this bill, one that would take away parental rights, the parental rights to allow children to live healthy, authentic lives. Tomorrow, without any sense of irony or shame, the same Patricia Morgan is sponsoring a parents' rights bill being heard in House Education. That bill asserts, quote, "It is a fundamental right of parents to direct the upbringing, education, and care of their minor children." Today, Representative Morgan wants to deny parental rights. Tomorrow, she wants to embrace them. Which is it? Actually, it is neither. The extremist, anti-LGBTQ, Moms for Liberty, gender binary or bust crowd is not about parents' rights. They are about eliminating their own discomfort. I urge you to please resoundingly reject this bill.
Thank you. Are there any questions for Wendy Becker? Thank you so much for your testimony.
We gave it a good try. How did we do? Thank you, Madam Chair. Thank you, Vice Chairs, all the honorable and esteemed members of this committee. Thanks for having us all in. My name is Gregory Wack-Molsky. I am a resident of Pawtucket. I work in East Providence, which makes me the least happy Rhode Islander most days of the week. I just want to say I drove across the bridge to get here. I know some of these guys came from a long way away, South County, other parts of the state. We love civics around here. By the way, I'm speaking in my capacity as the chapter coordinator for Amnesty International, Local Group 1016. We're one of the oldest, largest human rights organizations in the world. We literally have millions of members. I was the guy who could show up tonight. I want to just share with you a little bit of what we're going through here in this building. A couple of weeks back on March 5th and 7th, we heard the healthcare protector's shield bill. We heard it down here in, our Judiciary Committee, and then we heard it upstairs in the Senate. After the Senate hearing, one of our professional medical leaders in this country was accosted outside of the restroom by somebody with a camera asking, "Why do you think we're a hate group? Why do you have to say that we're bullies? Why do you have to say that we're waging a campaign of hate?" Refusing to honor the existence of protected classes of people across the United States. Gee, I wonder why. We love you coming out to our house. Anybody in this state that has any opinion on this, especially people that support bills like this, we want you here. Show up. Put your hand way up in the air. It's what democracy deserves, and we like to meet you all. So to take my amnesty hat off, people who have been interrupting here in this room tonight, I have friends that know a lot about you. We'd like to meet your friends. Let's all hang out in Rhode Island and talk about how we can all move forward. If we're really caring about our communities, let's all do this as a community. And let's maybe leave the hate and the ignorance from out of state, from the internet. Let's just leave it there. We really do look forward to talking to you more about all of these bills as we go forward. Thank you so much for your time. It's been an incredibly passionate night so far, and it's not looking to tamp down anytime soon.
Any questions for this witness? Yes, Representative Stewart has a question.
Thank you very much for both of your testimonies tonight. And I'm not sure which of you might be best able to answer this, or maybe both of you can. Would it be possible for you to talk a little bit about any work that's been done on the effects or impact of bills like the one that we're considering tonight on the health and well-being of adolescents, as well as older folks whose experiences are implicated and targeted?
So there's actually studies that address this directly, so I'll get them to you. What we know is the number one factor in how well kids do is support. It's support in the community. So when these hearings happen, even with an incredibly wonderful panel like you are, this is a supportive committee with lots of people I know from the past who have been champions of LGBTQ rights. And that doesn't matter. The very act of this in the news is harmful for people. So when there is testimony, positive or not, it is incredibly harmful on children and adults, because it leads to a climate of fear and anxiety. And I'm happy to actually get you the data.
It would be wonderful for the committee to have. Thank you.
I'd like to just echo what, my colleague Ms. Becker has said there. It's also really difficult on all of you. These campaigns, they're not necessarily meant to win. They're made to make this forum look really unreasonable, to encourage unreasonable people to get involved and encourage you guys to not stay involved. So thanks for sticking it out, and we're all here with you.
Are there any other questions for these? Representative Potter.
Thank you, Madam Chair, and thank you both for your testimony. Wendy, a quick question for you. You said a word right there that stuck to me. It said harmful. You said it a couple times, harm, right? And when you were testifying earlier, you made mention of some inconsistency of this bill and another bill. Can you remind me what the name of this bill is?
Yeah, it's the Help Not Harm bill, or something really silly. And You know, I have to reiterate that simply the fact of having a hearing is harmful. And so when we're talking about states where they actually have policies like this, I know Rhode Island won't do that. But even tonight is harmful.
Thank you.
Any other questions? Thank you both so much for coming.
The next witness, who is the last witness to testify, is, I'm sorry if I mispronounce your name, Jeremy Langille from the Rhode Island State Council of Churches.
Welcome. Is the red button on?
It is on, thank you.
Okay.
And you're the first person to correct my last name correctly, so I appreciate that. Thank you. So I'm here. I'm the executive minister for the Rhode Island State Council of Churches. I'm also a philosopher of religion and theology at Bridgewater State. I'm in the philosophy department there. I'm here to represent the council in our strong opposition to H7884. The Council of Churches stands against any kind of discriminatory legislative activity directed towards our transgender siblings and opposes any attempt to interject political ideologies of hatred into the provision of safe and legal medical care. The other piece I wanted to add is that prior to my work as the executive minister, I was in parish ministry for a very long time, working primarily with adolescents. And I was very fortunate to work in a religious organization that was very forward-thinking, that was inclusive. And so this meant working with lots of families of transgender youth. And I can say from that pastoral experience of supporting those families and helping be a part of that process towards healing and transformation, that I didn't have a single family that did it carelessly. It was always thoughtful. It was always involving medical practitioners and mental health practitioners, and it happened over a long period of time. And I was very grateful, in fact, that I got to be pastorally a part of supporting those families and being a part of that journey to health and to wholeness and to inclusion. So these kinds of bills really do the opposite, right? And as it's already been said, they cause harm, right? And they're really against who we are as Rhode Islanders, and certainly who I am as a person of faith. So the Council of Churches, whenever I think about what to come and say here, I see it through one primary lens. Does this legislation help us live into the house of fear or the house of love? And so that is how I think about things. This legislation definitely leads us into the house of fear, and we need to reject that. So the Council of Churches urges opposition to this bill. Thank you.
Thank you for your testimony. Are there any questions for this witness? Thank you so much.
That concludes the testimony.
So that concludes the hearing on House Bill 7884.